your pelvic health podcast. My name is Susan Winograd, owner and founder of Pelvic Rehab, and I am thrilled to be your host today. I am super excited about our guest today. She is somebody that I have been following and collaborating with and working with for some time. And I can confidently say that she is changing lives every single day. I want to welcome Dr. Alexandra Milspaw to your Pelvic Health Podcast. Dr. Milspaw, welcome, welcome, welcome.
Hello, it's an honor to be here. Thanks so much for the invitation, Susan.
Of course. Thank you so much for your time and your willingness to chat with me. Dr. Milspaw, can you tell us a little bit about yourself? Your background is so rich and robust and impressive. Can you tell our listeners a little bit about yourself?
Yes, absolutely. Well, I'll start with, I have a house full of dogs right now.
Oh my gosh.
Because I started babysitting my sister's dogs. And so I apologize if you hear any leash crankling. They're always super quiet until we start recording, right?
I always say if I could have a whole kennel, I would. Right now I have one. And my husband always says if it was a choice between him and my dog, he'd be worried. So we like puppies, no worries at all.
Yes. So we'll start with that fun fact about me. I love dogs. I love animals.
Me too.
So I always say my journey really started in college with the vagina monologues, actually. So I loved certainly the production, and I loved producing the vagina monologues because the cast meetings turned into this amazing women's circle where we would find, women would just start talking and sharing their stories and talking about their pain and talking about their struggles personally and sexually and intimately with partners. And it's, I started to notice the need. I said, there's a need here if there, and there's a big problem here as well, right? If almost every woman in this circle is having this issue and nobody can find help and no one can get answers. So it started there, and it led into a master's degree in counseling psychology. And through there, I met Gina Ogden, who became a main mentor of mine. She was a sex therapist and researcher, and also a Peruvian shaman. And so she brought in a spirituality aspect into sexuality and intimacy that I had never thought about and considered before. I didn't even know sex therapy was a thing until I met Gina Ogden. And I said, oh, you can get a PhD in that? Sign me up.
I love that.
So then that led me to discovering a physician in the town where I was going to school, and his name was Dr. Robert Eckenberg, and he was a pelvic and sexual pain specialist. And that's when he introduced me to the International Pelvic Pain Society, and that's when I met Amy Stein and Deborah Cody, who has transitioned on to the next space for now. But it was just eye-opening, and the first conference I attended, I said, this is where I belong. Wow. There were physical therapists like yourself and physicians from all these different fields, all wanting to share information. There's no ego there. There was simply truly the passion and the love and the care of all bodies, not only just, women and men, but everyone in between. And it said, okay, we want to, it shared the passion of, we need to do more research. We need to understand this. How do we help? How do we help more?
Yeah.
And then, as I say, the rest is history. So I had a private practice for about 15 years after I worked with Dr. Eckenberg for about 5 years in his pain clinic. And then I've recently joined Pelvic Rehabilitation Medicine back in 2021. And it's just pure joy to be able to work with an integrative modality, multidisciplinary core group that truly understands the need for the biopsychosocial approach to the whole system. And that's what I love about physiatrists and physical therapists, because you look at the whole person and you take everything into consideration, and everyone else seems to be trained, including my own kind, so to speak, including therapists. We zoom in and we only look at our piece of the pie. And that's truly a disservice to our clients.
And I hope that so many things I wanted to interject, but I controlled myself. I'll backtrack for a minute and comment forward, but I could not agree with you more about the practitioners and the healthcare providers in the pelvic health community. Part of the reason why I feel so blessed to be part of this community is because it is so incredibly collaborative. And, I could be wrong, but I know if I have a complex client or I have a question, I can tap into a global pelvic health community to ask questions and get advice and mentorship. And people are so willing and ready and wanting to help and contribute, because I really, truly believe that people who do this feel such a sense of purpose.
Yes.
It's truly, we're all different, but in a way, we all have this common uniting purpose of really helping people in a different way. So I couldn't agree with you more. And I think actually I appreciate that you acknowledge that, because we don't acknowledge it and give ourselves enough credit for being so collaborative with each other and really coming to the table with no ego, truly just wanting to help people and get the information out there. So I agree. The other thing is that I hope, Carolyn Van Dyken is really one of my greatest mentors, and she really inspired me to dive into that biopsychosocial approach in the true sense of the word. And I really, really hope that the whole paradigm is changing for how we heal people, because that the biomedical model for healing pain, just stretching and manual work, it doesn't work. It doesn't work for persistent pain. So that being said, this would be a good segue. Can you share with us your approach to healing pelvic pain and sort of how you fused the physical model with the psychological model and, healing the nervous system and the brain so that the body can heal?
Yes, absolutely. So I'll start with, what introduced me to that concept. So two different things happened at the same time. One, I started a certification course, a 1.5-year certification course that was in mindfulness-based stress reduction, neurolinguistic programming, hypnosis, and energy work. And at the same time, I started doing the trainings through the Neuro-Orthopedic Institute of Australia, where they did, their books are called Explain Pain, right? They're Explain Pain.
I love that. I love that series.
Yes. And, I saw Lorimer Mosley present and fell in love, with this concept. Now, I was a little biased. I had studied abroad in Australia, and I just love Australians in general.
Who wouldn't? They sound great when they talk.
Right. But it was this sense, this introduction from both, I would say, the psychological approach, as well as a PT and scientific approach of how it's all connected. And I think because of the breadth of numbers of people that are out there with persistent pain and autoimmune issues, and I think Western medicine has gotten exhausted with not sure and frustrated of not knowing what was that missing piece. And the introduction, that led to the introduction of a new field of medicine called psychoneuroimmunology. And it's truly about that bridge between the medical and the psychological world, and recognizing that the therapists need more training in how the body works, and the physicians need more training on the power of the mind and the energy system and everything that goes along with being a human and being alive on this planet. And so I think knowledge is power, but I think experiencing it is power as well. And so helping folks understand and being curious for myself of what are all the different ways that we could present this information in a way that's can be integrated into someone's worldview without threatening too much the worldview that they're coming from.
Right. And I find that that's really challenging.
Yes.
Right. Shifting the mindset to fixing the body to there's so much more than that. And I think, as a physical therapist, that's the hardest thing for clients to wrap their head around, because having someone do, manual therapy to you or having to do a couple of stretches a day is, I think, a lot easier for people to wrap their head around and accept, because that's what they've sort of been indoctrinated with, then, okay, pain and trauma can actually physically change your brain. So in order to heal your pain, we need to then retrain your brain also.
Absolutely. And as you said, we were walking a fine line truly of a trauma response with patients, because particularly within the pelvic and sexual pain world, there's all this stigma around the location of their pain, which adds to the silence. But what I'm more leaning towards is that the amount of dismissal and rejection or hopelessness that they've gotten from doctor after doctor and even therapist after therapist, because therapists seem to be scared of pain and trauma as well. Until recently, we're now kind of again understanding it, and we now feel effective at some of the tools that we have. But when we present it to patients who have and clients who have had that a trauma experience and or high stress experience of someone saying, "Well, you just need to relax," as if that's an easy thing to do without taking into context life.
Yeah, I always tell clients, if everybody could just relax, wouldn't everybody do that? If only it would be a very different world. And it's so much more complex to that. And what I tell people is that relaxing your mind is a skill that needs to be practiced and repeated in order to be integrated. And I think there are very few people in today's day and age in the world we live in that can do that, easily or naturally. I would say, I don't know of anybody that can. So how do you start to tackle, what's your first step when you meet a client who has been in the biomedical model, the conventional model, and they've gone to every doctor, they've had every test done. Of course, pelvic rehab medicine is different. That's why we love collaborating with them. But, I know the clients that I refer to pelvic rehab medicine already probably have been to 5 to 7 to 10 other doctors before. And they've sort of been stuck in that cycle until they find something different. How do you begin to educate them that there's a lot more to it for long-term healing?
So twofold. One, I always start off by asking them, do you want to understand what needs done and how, the why and the how, or do you just want to experience it and it's okay if you don't understand it, right? It's kind of like, do I need to understand how Wi-Fi works, or can I just utilize it?
Right. Interesting.
I just enjoy it. Because some people are ready to just delve into some of these exercises and they trust the process, so to speak, or they trust me for whatever reason that they've experienced. And other people say, no, I don't want to do any of this stuff. It feels weird. Or again, they've had trauma and stress around kind of almost a performance anxiety of breathing exercises or meditation or mindfulness. And so they're like, no, I want to understand the science first. Okay. So I'll start with where they want to start. And if they're open to and wanting to learn, I usually try to understand what are they already familiar with, and then I use a metaphor with what they're already familiar with, right? So if I'm talking to a gardener, I'm going to talk about the garden of the mind and the larger biodiversity of nature and how we need a few different things, right? If I'm talking to a computer scientist, I'm going to say, okay, we need to update the hardware before we can update the software.
I love that. I love that term. I've heard you say it before, and I absolutely think it's brilliant because it's really a concept that everybody can understand and easily apply to their body. Yes. So, the metaphors and the narratives just work well and are not threatening. And, in terms of, and it goes across language barriers, and it can cross different educational experiences, so it's just allowing the human to human experience of being able to understand it without needing all the details. So I start there. And then when they say, oh, okay, that makes sense. I'm also sure to say, it's not all in your head. Your brain happens to be in your head, and your brain is a big piece of how the nervous system reacts. But there's also memory in every single cell of your body that also has a mind of its own. Yeah. And
again, the gut brain connection and how inflammation changes. And, once they really tend to understand some of even just the micro pieces of the science and the understanding, I see their body relax. Yeah. Right. A sense of almost as if shame and self-blame is able to evaporate off a little bit and saying, okay, it's not my fault. I'm not doing something wrong.
Yeah. And also because they've probably been dismissed and have been told it's all in their head. And for so many of my clients who have had literally every test done in the book, the only answer that they've gotten is your test is normal. But no one's ever explained to them your test is normal, but your pain is real, which is so emotionally debilitating for clients to hear. Like, okay, then they start this emotional, process of they're all telling me everything's normal, but I'm still in pain and I still feel like crap. So there must be something wrong with me.
Sure. Right. And, that sense of feeling broken and that the level of permanence. Right. So I do absolutely interweave, again, metaphors and education, because it allows the subconscious, for sure, and definitely the conscious mind, to be more open to understanding why these techniques are going to work, and kind of understanding we need to, if my phone malfunctions, if I don't turn it off after a few days, what do you think our brain is doing if we haven't had that reset? And so again, it's not about who's bad or what, who did you wrong or what are you doing wrong? It's understanding what we need. We can't fulfill the body's need if we don't even understand that it's there.
Right. So in a way, even for people that are like, okay, don't need the education, let's dive into it, you are in a sense educating them in a way that's relevant to them, right? It sounds like that. Yes. We do tons of pain science education because, research has shown when people understand what's going on in their body, that's a really important step in healing. And, maybe I should take a cue from you. And that's why I love doing these talks, because I learn so much from the language that other practitioners use. But for people that have persistent pain, I very often say, I'm going to send you a couple of simple videos on why you may be experiencing pain. Humor me. I know you're thinking I came to you in pain. Are you seriously going to send me home with pain science videos? And I just say, humor me. They're very short. Just watch them. And 99.999% of the time they come to me and they say, oh my gosh, like I felt like that video was talking to me about me. And so often, like you say, you see that coat of armor sort of shed, and it's so, that in and of itself is so healing, I find, to know that they're not the only one.
Yeah. And you're absolutely right. And I would agree that when I'm working with someone, if they want to jump right into the techniques, I'll do that. And I sprinkle, oh, here's what's happening, right? Yeah. Again, kind of tidbits as if, because shifting someone's worldview and their understanding of their body, that, if they haven't had an anatomy class since fifth grade health class, right?
Yes.
It's not, you're not going to build the whole Lego set all in one sitting. It's going to be a few Lego pieces each visit. And as you said, sending them information if they're curious and if they're ready, they'll watch those videos and get that information on their own, which allows them more of the conversation to flow.
Right.
So it doesn't feel so top down in terms of, here's me, the expert, teaching you about your body.
Right. And that I love what you just said, which is a great segue. Part of what I love about your Retrain Your Pelvic Pain series is that it's not at all just about, I'm the expert, let me tell you how to retrain your brain. You truly empower people with strategies that they can implement on their own very easily to help themselves retrain their brain. Because I think we're already coming from a paradigm where people think, I go to a therapist, whether it's a psychotherapist or a physical therapist, and you treat me in order to heal me. Right. And I hope that's really becoming a thing of the past, where people are viewing us as a partnership, as part of a therapeutic alliance, where we're guiding them and we're more coaching them and empowering them with tools to heal themselves.
Absolutely. Absolutely. And I call it the healing buffet.
I love that.
It's not a one size fits all, even though, well, I might argue some of the pieces absolutely will help you, whether you want it to help or not.
Right.
But here's the buffet. Because everyone is on different parts of their path. Everyone's on different levels of readiness, I'll say. And as if they're able to choose the pace at which they start these techniques, and they have the science to help them understand that no matter what they do, they're still moving forward.
Yeah.
It's that sense of, I'm not in a rush, right? Anything built in a rush is not as sustainable as a builder that takes his time. Right. So we want to allow.
Yeah. Which is so challenging because we live in a world of instant gratification.
Mm-hmm.
Right. I don't know why this bothered me so much, Dr. Milspaw. And I was in the car with my husband and we were driving by a fast food place. And the line for the drive-through was like 100 cars long. I'm like, doesn't anybody make their own food anymore? I mean, I feel like it's not even just, fast food, it's coffee. Like we can't make our own coffee anymore. We can't even go into a coffee shop. We have to go through a drive-through. So I feel like that's part of what contributes to our pilfer and ill kind of culture, because we live in a fast world. We live in a world of instant gratification. If my kids text someone, or if they even text me when they know I'm working, if I don't respond in 10 seconds, they're like, why don't you answer your phone? Why aren't you responding to me?
Sure,
people are
that
so
expectation to respond and be present constantly.
Yeah. And I think part of what's difficult for people is that healing is not really about instant gratification. It's really like a journey.
Yes, absolutely.
And it takes time, right? How do you deal with people? How do you inspire people who come to you? So clearly there's a certain level of readiness, but they still feel like there's a tissue issue when other practitioners have established that there is not. So, in my practice, I have a lot of clients where I always rule out a tissue issue, which I mean, like a musculoskeletal issue. And I determine that their body has healed, once we've resolved everything. And